Hi everyone, my name is Emma Thornton. Today I will be talking about breast cancer. This is my audience. Did you know that every 2 minutes a woman in the United States is diagnosed with breast cancer? This topic should be important to you all because it is likely that you or someone you know will be affected by it at some time in your life. Breast cancer is a devastating but treatable disease that impacts millions. To illustrate this, I will discuss what breast cancer is, the risk factors, symptoms, and the treatment options available. Now that we can recognize how common and serious breast cancer is, let's take a look at what it is, who is at risk, warning signs, and how it can be treated. What is breast cancer? According to the American Cancer Society in November of 2021, doctors and oncology certified nurses on the medical and editorial content team state that breast cancer is obviously a type of cancer that begins in the breast. It can begin in one or both. The breast is an organ that sits on top of the upper ribs and chest muscles. Each breast has ducts, glands, and fatty tissues. As you can see in this photo, the ducts are the tunnel-like areas that lead to the nipple, and these other areas are the lobules, also known as the glands. The ducts are small canals that come out of the glands, which I showed in the photo, and carry milk to the nipple. This is the most common place for breast cancer to begin, and those are called ductal cancers. The glands, also known as lobules, make breast milk. Cancers that start there are called lobular cancers. There are more uncommon types of breast cancer as well. Pageant disease of the breast is a type of breast cancer that can start in the nipple. Another type of breast cancer is Floyd's tumor. This starts in the stroma, which is the fat and connective tissue that surrounds the ducts and the glands and helps keep them in place. The last one is angiosarcoma. This can start in the lining of the blood vessels and lymph vessels that are found in each breast. Breast cancer can spread when the cancer cells get into the blood or the lymph system and then are carried to other parts of the body. Lymph vessels carry the lymph fluid away from the breast, so the cancer cells can enter those vessels and start to grow in the lymph nodes. If they begin to grow in the lymph nodes, there is a greater chance that the cells could have spread to other parts of the body. With that basic understanding of what breast cancer is, we can now explore the factors that can increase your risk of developing the disease. Risk factors for breast cancer, according to the Center of Disease Control and Prevention, an article on their website titled Breast Cancer Risk Factors, published in 2023, states that several factors can increase the risk of developing breast cancer, including genetics, family history, or age. Some women may even develop breast cancer without any known risk at all. Just because you have a risk factor does not mean you will absolutely get the disease, and not all factors are on the same level. Most women do have at least one risk factor, but the majority do not ever develop breast cancer. There are a lot of risk factors that you cannot change or get rid of. An example would be family history or personal history. If your mother or sister or any other family members on either parent's side of the family has had breast cancer, your risk may be higher. If you have had breast cancer before, you are more likely to get it again. Another example would be getting older. The risk for breast cancer has been proven to increase with age. Likely, if you were exposed to hormones longer by starting menstrual periods before age 12 or starting menopause after age 55, that would also raise your risk of getting breast cancer. There are some things that you can do or change to lower your risk of getting breast cancer. Women who are less active are at higher risk, so go to the gym, get your steps in, ride a bike, just stay active, and that can lower your risk of potentially getting breast cancer. If you are pregnant after age 30 and do not breastfeed, you also may be at higher risk. If kids are your thing, maybe talk to your partner about the risk of delaying pregnancy. And the last thing you could do to lower your risk of getting breast cancer is to not drink alcohol or at least limit your consumption. Knowing these risk factors helps, but spotting the warning signs of breast cancer is important for early detection. Warning signs of breast cancer, according to the Susan G. Komen Organization and an article titled Warning Signs of Breast Cancer on their website that was published in 2023, most early stage breast cancers in the United States are found with screening before any warning signs or symptoms appear. However, breast cancer can also be detected early if people notice the warning signs. The most common warning sign are nipple discharge, a lump or hard knot inside the breast or your underarm, change in size or shape of the breast, or just any change in the look or feel of the breast or nipple in general. A change in your breast does not immediately mean cancer, but it is important to always get it checked by a doctor. Nipple discharge can also be normal, but like I said, it's always important to get it checked by a doctor. Now that we have covered the warning signs, it is important to know what treatment options are available to those trying to manage the disease. Treatments for breast cancer, according to the National Cancer Institute in their PDQ summary titled Breast Cancer Treatment that was published on their website on March 14th of 2025, treatment for breast cancer can involve surgery, chemotherapy, radiation, or hormone therapy. The different types of therapies, they are tailored to the individual's cancer type and stage. So the surgery involves removing the tumor in the breast or the entire breast itself. This would depend on the size and the location of the cancer. Chemotherapy uses drugs to kill the cancer cells or stop growth. This can be used before surgery to minimize the tumor or shrink it, and after surgery to reduce the risk of the cancer coming back. Radiation therapy is also used after surgery for the same reason. Hormone therapy blocks hormones such as estrogen or progesterone that influences cancer growth. Doctors may combine these treatments, but they are all personalized depending on cancer type, stage, and the patient's overall health in general. In short, knowing the risk and signs and treatment can help save lives. Breast cancer is a devastating but treatable disease. It is when cells in the breast grow out of control and spread. Risk factors like inactivity or being overweight can increase the chances of getting it. The warning signs include pain, lumps, or skin changes. Treatment options depend on the stage of cancer and can include surgery, chemotherapy, radiation, or hormone therapy. It is a serious disease, but understanding the risk factors, warning signs, and treatment options can help save lives. Staying informed and talking to your doctor is what is most important.